Welcome to Profound Conversations, a dynamic broadcast platform focused on building healthy communities. In an ever-evolving world, new ideas and transformative ways of being are the lights at the end of the tunnel. Please join us as we participate in critical and profound conversations impacting humanity.
This is Profound Conversations, a space where we engage in the process of understanding how we can be and become better. Profound Conversations is excited to have a conversation with Fatimah Linda Howard, a CEO of With Linda Howard, a specialist in this idea of understanding diversity, equity, and inclusion. She's a person who spent over 30 years of experience in the law, understanding how to engage in litigious matters, but also how to manage healthcare operations. A person that has passion for wellness and a commitment to making social change for the populations. Sister Fatimah, welcome to Profound Conversations.
Thank you. It's good to be here.
It's good to have you here. It's good to have your wealth of knowledge, a woman who's a leader in the space of organization development, asking a difficult question to come up with very profound, to ask even more difficult questions to get to better solutions. So in this process, how did you get to this space, this moment where you begin to look at this idea of DEI? Who is Fatimah Linda Howard, and how did she come to this space of diversity, equity, and inclusion?
Well, I will say I didn't get to the space. I was born into the space. So people often ask me, when did you start doing diversity, equity, and inclusion? And my response is always, I've been doing it all of my life. I recently released a book called Crescent Over Crossroads. And in that, it's really my memoirs, but I talk a lot about some of the challenges of navigating America, navigating corporate America, being a woman, and in certain environments, being an African American in certain environments, being a Muslim in certain environments. I also talk about in my book, I talk about some of the challenges in my family that we went through in dealing with the healthcare systems and some of the premature deaths. So through all of my life experiences, what I've seen was that there are definitely opportunities for us to start looking at equity and for us to start being included in the conversations and be included in the solutions. And so I started out practicing law. Then I began to do healthcare compliance work. And that brought me into that healthcare space. And as people started to look for solutions, as DEI became a real conversation and people started to look for solutions, I started to offer my services as a consultant to be able to navigate some of these challenges and navigate them from the perspective of looking at kind of bringing in my compliance and my equity side is like, how do you begin to address these issues from a standpoint of the right thing to do? Putting on my legal hat, what do you need to do in order to mitigate the legal risk? And then looking at just my life experience with the healthcare system and illnesses in my family, looking at what impact does this have at a community level? Because oftentimes people don't have the conversation around DEI in terms of the multi dimensions of it. And we end up in these conversations equating DEI with affirmative action. And DEI is so much bigger than that.
So you're tell me that DEI and affirmative action are not the same thing?
They are absolutely not the same thing. Affirmative action is one way to achieve diversity, equity, and inclusion in employment, in retention, possibly in hiring vendors. But that's only one aspect of it. if we and some of the areas that, that let me back up a little bit. As a lawyer, one of the things you'll see in contracts, in the beginning of contract, you'll see a definition of terms, because people will use a term and that term doesn't mean the same thing to everybody. So when some people think about diversity, equity, and inclusion, they think about it in the context of hiring or admissions into universities and not looking at all the other ways. I have the conversation about DEI from the standpoint of building global competencies, addressing economic issues in the community, addressing religious intolerance, addressing health inequities. It's not just about affirmative action and hiring. It's an important aspect in some sense, in some places, but it is not the same as DEI.
Let's go to this idea of diversity, equity, and inclusion. I mean, because your answer was just so profound, because people are misconstruing the two. What is affirmative? What is it that we should attend to? And we're going to go back to your University of Pennsylvania Law School and what you do with the National Wellness Institute. We'll come to that. But I wanted to really hit this piece of this diversity, equity, and inclusion and affirmative action, and what do we need to know about it, and why may it be under attack at this time?
Well, I can't speak to why it's underneath attack. I think this is it's very political. And what the political strategy was in terms of putting diversity, equity, and inclusion on the chopping block, I don't know. I mean, there was a strategy to put immigration on the chopping block. So I can't speak to what was in the minds of those who decided that this was going to be the target. But the reality is it is the target. But from when I think about it, what's happening now, to me, it's not surprising, because we have seen, in terms of communities of color, marginalized communities, we have seen systems set up that were not for our benefit for hundreds of years, since we arrived in this country. So this is not a surprising move. But I think what is surprising is that we're surprised by it. Because what I'm seeing is that people are actually surprised that this is happening. I'm not surprised. I think that when we tie our success, our well-being, our happiness to this political structure, I think we're going to always be in a reactive mode. We have a changing of the guards every 4 to 8 years. We can have the who is leading the House and the Senate can change every 2 years. So that our political system is constantly in a state of flux, and the political system, people do what they need to do in order to get elected. So that means different things will end up on the chopping block. And this time it was diversity, equity, and inclusion. I think we have to start looking at, how do we start building systems within our communities? How do we start embracing the concept around doing for ourselves? How do we do these things at a family level? How do we do it at a community level? How do we do it within our own institutions? How do we start building institutions so we're not in these conversations constantly about, hey, something was taken away from us?
So you're talking about do for self, right? And build institutions. I think that is so critical in this space. And I think that has been done in the past. The community, Black community especially, has been able to create communities that people have come in and just simply destroyed them. People are very familiar with Black Wall Street, Oklahoma. They're familiar with Rosewood, Lake Lanier in Georgia, where the community was thriving and it was flooded. Spaces where they were railroad that came straight through certain spaces. So this has been something that has happened over the years and has been taken away. It's been procured, just actually ravaged by different individuals, people who deem themselves to be the dominant group. So this is a constant narrative that we're hearing. However, what is so critical is that we must continue to build, because it's in us to do so. I want to share something with you about DEI before we get into what we can do, because that'll be part of our deeper dive. Is that there was a communique that I received in a certain workspace that is tied to the federal government, and it suggested that the reason for stopping or dropping this DEI is because these programs divided Americans by race, wasted taxpayers' dollars, and resulted in shameful discrimination. So the rationale for addressing the issues that are looking at diversity, equity, and inclusion is that it says these programs divided Americans by race, wasted taxpayer dollars, and resulted in shameful discrimination. What are your thoughts about the idea that DEI is divisive to America, wasteful spending, and is a shame on the country?
I mean, that's to suggest that America wasn't divided before there was a DEI conversation. I mean, there was a DEI conversation because of the division, and because of the inequities that's happening in America. So I think America has been divided by race. I mean, we have 400 years of slavery in this country, and then we had a series of things that follow that. So to have a conversation to say that it was DEI that divided this country by race is is inconceivable. It's like, no. So I do think, as I said before, that these are talking points. This was a platform, and this was a platform that was successful in terms of putting a president in office, and really actually flipping the House in the Senate. So these conversations it served its purpose, and this is now fulfilling on the campaign message that once I get in office, I'm going to do these things. And within the first week, these things were actually then put in action. But no, I don't think DEI divided people by race. I don't think DEI was a method of discrimination. And again, this is even breaking DEI down to a very small component of DEI. Like, as I mentioned earlier, one of the things that I focus on is around health equity. So it's diversity, equity, and inclusion. And then you will hear a lot of organizations add other things to that, but belonging, justice, access. So there's a number of things that you'll hear added on. But just let's focus on the equity part. Dealing with the issue of health equity, there is no division by race in terms of discrimination. What health equity is designed to do is to make sure everyone gets quality health care. And when when healthcare systems are not designed to address various populations, what you have is premature deaths. You have people who won't go to the doctors because the systems are not set up for them. You have populations that don't trust the system. And when I put on my compliance hat, I even think it's a compliance issue, because if doctors are not, and hospital systems are not set up to provide competent health care to individuals, and then they turn around and bill Medicaid and Medicare for incompetent services, I do believe that is a false claim. They should not be billing for a service that they did not deliver at an adequate level. So I want to just kind of get people to start thinking about DEI in a broader sense. This is not just about hiring individuals. Who did you hire? This touches economic systems, it touches healthcare, it touches education, it touches hiring. And so to have a conversation about, oh, yeah, we're going to dismantle DEI and federal agencies because it divides America by race, I say, no, that's talking points.
Okay. The reason I brought that up is that because your point on the backside is very critical. I bring it up because you graduated from the University of Pennsylvania Law Center. You understand languaging and the law, and the talking point fits very well with a law presentation. Is that you present content on the front side, and then the counter discourse has to go back and somehow work against that, swim upstream against that. And then it ties into group think, right? Psychology, the idea of the group was already thinking this because they have felt encroached upon because they have had to think about the unfair advantages that they've incurred based on this construct of race. And so it sets up the seatbed by which one can begin to say, yeah, let's overturn this, let's overthrow this. And so you're doing a great thing. So that's why I did that, because you understand law. You understand how to present an argument, a case. You understand why it's so important to be on the front side of something so that you can set the precedent for the entire case to be dismantled. So that's why I asked that question. What are your thoughts about that? And you said, go ahead, I'm listening.
Yeah, I mean, one of the things that you learn in law school, the first year of law school, is the one who can frame the issue can win the case. And so I think that's what I think that's what they're doing. It's an attempt to frame the issue. And so they're framing this issue in this way and then build the case around it. But I think that organizations, corporations are going to really have to decide how they're going to move forward in this new climate, because you have some states have put forth legislation that discourages or even outlawed DEI programs, certainly within state agencies. And you're seeing the same thing in the federal. And then that will start to expand to anybody who receives federal funds. Then it will expand to anybody who does any contracting for the federal government. And once you start to expand that reach, that scope of what constitutes federal, then organizations are going to start to say, hey, if we do this, are we going to be in violation of the law? But the flip side of it is, if you don't do it, you're going to be in violation of other laws, because we still have anti-discrimination laws in place based on race, gender, sexual orientation, religion. We still have the disability laws that discriminating against people based on their abilities and not providing reasonable accommodations. So you have all of these laws that are still in place. Mm-hmm. So by dismantling efforts, abruptly stopping efforts to be inclusive will result in organizations being exclusive. And so as a result, they will see that they will now have to address other federal laws. So this is going to be a really challenging period for organizations as they say, hey, so they told the federal government not to do it. Does that mean we need to dismantle our DEI programs? And I think that they're going to find some challenges. And I also think there's going to be some real public backlash as well.
I agree. I also like what you were saying about it's more than just who you hire and about the issue of incompetence. And so there are these discussions that go around within the population that suggest that a DEI hire is one who is incompetent, who doesn't have the skill set. However, you presented a slightly different color on that. You said that sometimes people are billing for incompetent services that they delivered or incomplete services that they deliver at high rates, and that is problematic. So
Right.
I
It,
love it. Go ahead. Go ahead. It's okay.
yeah, it is because if you take for instance, if you take a physician who is not a physician of color, that somebody can claim, oh, he was a DEI hire, and that physician is being paid to treat anyone that comes into to the hospital or into their doctor's office. And when they don't have the multicultural competency to address the needs, and some of that is, okay, I don't understand some of the culture that could impact the care. But you now also have, and I'm not going to do a deep dive into this because I do a whole discussion around AI in healthcare. But you have
We
now,
want to go deep. We want to go deep. We're going to go deep. Make it come back and do it again. Keep going.
but AI in healthcare is some of the AI is bias. And so as a result, hospitals, physicians are using these tools. And for instance, there are AI tools that will help detect skin cancer. But if those tools are not set up to address darker skin, what you have is a misdiagnosis. And so this is not a DEI hire. This is someone who was hired who cannot actually do their job for a cross section of the population. And then they turn around and bill the federal government for that service. And so for me as a compliance officer, my hat as a healthcare compliance officer, my hat goes on, that compliance hat goes on. And I say that's a quality of care issue. A quality billing for a service that you didn't provide the quality is a false claims. And that is a serious violation of federal law. So you can say we're going to dismantle all DEI training. Okay, so does that mean that those who are delivering healthcare are not going to be trained on how to do it in a competent manner? So having kind of these knee-jerk reactions and having the pendulum swing all the way in the other direction, I think it's going to have a really negative impact, and organizations are going to start to find that they have other issues. And this president will be out of office in 4 years. But those issues that's created today will survive those 4 years because it's not easy to undo things. A lot of things is not easy to undo. So yes, I think people are having a very one-sided conversation.
So Fatimah Linda Howard is telling us about how to look at this idea of DEI and to look at how we have misconstrued some of these constructs and assume that one it can be interchangeable with other. That is affirmative action for DEI. To understand that it does not mean that there's incompetence in hiring. It means that there's something else that needs to be looked at more deeply. Also, this notion that it is not the thing that has been divisive, that the reason that it exists is because the division exists. Nepotism has existed. People have been hired for certain jobs based on their skin color or their connections with individuals, and people have been excluded from that process. People who've been excluded have oftentimes have been very competent at the jobs, but never given the chance to demonstrate their competency. And so DEI comes in the space to be able to address that. But also, I love the conversation about the things that we think are neutral in the process of life, AI, because of the creator. The creator creates it in the context of their existence, then the product itself becomes a function of that particular population. We just want to honor you for these powerful words. And in this segment, because we have to take a deeper dive into your work and the wellness area. Is there anything that you want to close out this segment with that we need to think about and how we can be better at the business of understanding how to be responsible around DEI?
One thing I'll say is don't believe the hype. And I think people just have
Don't
to,
believe the hype.
I think people have to think more critically. And people have to start examining and asking the question, the whys, asking 6 whys. Why is this? Why is that? Why is this? I think we have to broaden the framework in terms of how we think about diversity, equity, and inclusion. And I definitely think that we have to be more proactive and not be reactive, and understand that we cannot look at ourselves as victims every time a new person get into the White House, because we're going to have new people, and we're going to have new people in the White House. And so this is a time for us to really rethink things, re-strategize, start thinking about how do we build more in terms of community. How do we do more for ourselves? And I understand what you said in terms of some of the communities that we've built that have been knocked down, but we know that even when you get knocked down, you need to get back up. And so I think that that's really what our focus needs to be. But I will close with definitely don't believe the hype, because that's what this all is.
Don't believe the hype, right?
Yes.
Don't get caught up into leadership. Don't follow leadership. Or powerful words. That is, how do we be, do, and become? Is that we do our own research. We do a deep dive. We think, not simply be reactionaries. We think, and then we create. We create that which can generate something for generations to come. And so we don't have to believe the hype in the other person's reality, but understand that we are the ones that we've been waiting for. This has been Profound Conversations. We've been here with Fatimah Linda Howard, and a phenomenal, not only attorney, but also an activist, a specialist, a consultant in the space of understanding how we can have better diversity, equity, and inclusion in this world. Thank you so much for being here.
Thank you for joining our Profound Conversation. If you found this episode helpful, please subscribe to our podcast and then gift this information to a friend or family member using the share button. You can find our show on all social media platforms as well as on our website at profoundconvos.com. Profound Conversations executive producers are the Muslim Life Planning Institute, a national community building organization whose mission is to establish pathways to lifelong learning and healthy communities at the local, national, and global level. The Profound Conversations podcast is produced by Erica Christie. Programming is produced by the Aliyah Network. Thank you for your support.